Hello, good evening. Welcome to Midweek's Mental Health. We are back with another guest with a super interesting topic called OCD. If anybody has questions regarding OCD, please feel free to post them in the comment section. We'll answer during the live or after the live. Hello. Dr. Archana, I'm not able to add you. Can you connect through maybe another device? Good evening. Meanwhile, I want to tell everyone why I chose this topic. Obviously, OCD is a very important topic. There are many myths about this disease. A lot of people have their own interpretations of what OCD is. It's merely reduced to an English word. So I thought, first we can unlearn what about OCD and then start learning. So I'm gonna definitely start this topic with making you unlearn everything that you know about OCD through media or through Instagram. And me and Dr. Archana will be able to help you understand what exactly OCD is. So you'll know if someone around you requires help, you can help. Meanwhile, if anyone thought they had OCD in life, you can give me a thumbs up. A lot of people think being very clean is definitely not the case.
Hi, Dr. Sharon.
Hi, how are you?
Yeah, I'm fine. How are you? Just had a technical problem. Yeah.
Yes. So for everyone, Dr. Archana is a psychiatrist from Chennai. There is a cyclone in Chennai right now. So if there are any network issues, please bear with us. He's working through the cyclone for us. So also Dr. Archana is my senior from Father Muller Medical College. She's one of my favorite seniors. I think you're in final year when I just joined. We had tag duties and stuff, right?
Yeah, exactly. Yeah, we did. You
My
joined when I.
earliest Right. My earliest memory with you was we all had tag duties. You're the only senior who didn't care if the junior was there or not. You kept doing your work. You never dumped your work on the juniors. Everybody's like, I want Archana ma'am, all the juniors.
So I must start getting more strict, I guess, with my students now.
Yes. Can you please tell everyone where do you work? What are you doing these days?
Yeah, I'm totally into private practice. I have my own clinic near T Nagar in Chennai, and I do work in another clinic in Ananagar in the morning. My clinic is named Inside Mind Care Clinic, and I do a few programs in the TV in the Tamil channels because I'm from Chennai. I do Tamil programs, and I do column writing in a lot of local newspapers and Instagram interviews and awareness talks in various colleges and schools. So that's what we've been doing as a team, to be frank, and mostly addressing adolescents with regard to various mental health issues, so that they know whom to pick when they have issues.
Yeah.
Like most of them now are bold enough and smart enough to tell their parents that I have an issue, please take me to a psychiatrist. So we are seeing students like that coming to us. So that's actually a good thing. Even before the parents can pick it up, the students are able to identify. So that's what we're aiming at by educating them. So
Yeah. Also, that's the most sensitive age group.
exactly. Yeah, true.
Yeah.
And sometimes they are not comfortable discussing it with their own kith and kin. They are more comfortable discussing it with a professional. So
Yeah. I mean, that's the right way to be, I feel.
yeah.
So I was telling everyone why I chose OCD, right? Because a lot of people reduced OCD to an English word, right? I mean,
True.
I know so many doctors also, non-psychiatrists, they kept telling, oh, my OCD is kicking in, or her OCD is kicking in. She's OCD. I don't understand what is she's OCD means. Like, that's not even English. So anyways, even in med school, so my immunity isn't great. So I used to have a lot of infections as a child whenever I eat from street or anything like that. So I'm very careful about my food, where I'm eating from. So I kept washing my hands so that I don't get infected. So a lot of people teased me saying that I have OCD in med school. So it's almost that they made me believe that I have OCD. And I even went and met a teaching psychiatrist there, and she said, no, you're just clean.
Yeah.
Yeah. So what
Very,
exactly? Yeah.
yeah,
Sorry,
like
sorry.
interchangeably used word, I guess, similar to depression. Like nowadays, everyone is like, I'm depressed, I'm depressed. So it actually reduces the authenticity of the word, I guess.
Yeah. True. So what exactly is OCD?
Usually we hear people telling I'm obsessed about something in the right sense, as in I really want it. But in OCD, the obsession doesn't have the same meaning. As in, the obsession is the repetitive thought or the images which the patient or the person gets, which is actually which is not his own, which he's not comfortable with. But mostly, the word obsession, when we use in a layman's term, we use it for something which we are so pumped up to do, something which we really want to do. I'm so obsessed with it, as in you like it so much. But in OCD, the obsession is totally different. They don't like it at all. They really want to come out of it, but they are like sort of strangled into it. They're getting suffocated into the obsession. So it's actually a totally different spectrum of meaning, the obsession in OCD. It is not as common as the obsession which people who are really motivated use. That is a totally different term. So here, the person is like, he knows it is absurd. He knows it is not right. He knows it's not his thought or action or whatever. He knows it's not from his physique or from his mind. And he is unable to control it. That is the most, disgusting part of an OCD, wherein the person feels he's not in control of an event which is happening to him, and it is not his own. So it is like something is forced upon him, and he's not able to control it. It's totally going. It's like a bike out of your control, and the compulsion is something which is this obsession forces him to do to relieve his anxiety. It is like, when the person gets repeated obsession, these intrusive thoughts or these repetitive unhappy thoughts, he goes into an anxious mode. He becomes very panicky. So that will drive him to do something to relieve the anxiety. That something which is done to relieve the anxiety is the compulsion. So
Right.
if it is a thought about dirt and all that, like what you said, they start washing hand or cleaning. So that is the compulsion. That will make them less anxious. So that is why the term is coined as obsessive compulsive disorder.
Right. We'll do a small exercise here, right? So here I am. I'm a person who is, I believe I'm extremely clean, but well, extreme is subjective word, right? I think I'm extremely clean. Maybe to most of the people, I might look like someone with a problem. I want you to play someone with OCD, right? How are we both different, right? I'm going to tell what I feel and you're going to tell exactly the contradicting one, right?
Okay.
So people understand better. So Dr. Archana is playing a person with diagnosed OCD. I'm a person who is very clean. People might be thinking I have OCD, but it's not. So first thing, I wash my hands multiple times a day.
Okay. I too wash my hands multiple times a day, but it is not as in 5 times a day. It's as in I wash it 20 to 30 times at a particular time, exactly within a span of maybe 5 minutes. I'm doing the same action around 20, 30, 40 times, and I'm doing it with a lot of distress. I'm not doing it because I must be clean. I'm doing it because I have to do it.
Right. Okay. I wash my hands because I get these thoughts that probably my hands are contaminated, and I think these thoughts are completely valid and rational.
I wash my hands repeatedly because I have the thought that they are dirty, they have a lot of germs and something which will affect me. But I know that my hands are not dirty. I'm aware that my hands are clean. So I have a conflict wherein why am I washing my hands? They are clean. But I'm forced to wash it because of my repetitive thoughts. I don't believe that my hands are dirty, but I keep washing.
For example, if I'm in the middle of a class, I won't run out of the class to wash my hands. I can control till the class gets over for me to wash my hands.
I can control to a certain degree, but when it goes above that threshold, I have to wash my hands. If not, even if I'm not leaving the class, I will be unable to proceed further with the class. Either as a student, I will not be able to concentrate, or if I am the teacher, I will not be able to teach. So my only option would be to either go wash my hands or to just stop things there.
I can have anxiety because I'm extremely clean person or neat freak. That my God, I need to wash my hands, otherwise I'll get infected. Right? Once I wash my hands, my anxiety is gone. I don't have to do it again.
So my thoughts are also based on cleanliness. But the issue is, once I wash my hands, I know my hands are clean, but my thoughts don't stop with it. My thoughts are linked to something else. As in, if I don't wash my hands, something bad might happen to me. It is linked to another event. So I don't wash my hands for cleanliness. I wash my hands because I don't want that bad event or bad something to happen, either to me or to my loved ones. As in, if I don't wash my hands, my mother might get hurt. So I keep washing my hands so that my mother doesn't get hurt. Though I know my hands are clean.
Right. I think that's a great exercise. So for people, if you want to go back and watch the video again, understand, I think my thoughts are rational. Whereas she thinks her thoughts are not rational, but she can't help. She can only control her anxiety by washing her hands. Well, OCD is not just about washing hands. What are the different forms of obsessions and compulsions?
The most common is actually, washing your hands or whatever, washing your bathroom or the bathing compulsions. There are so many other things. One thing which is very common and which most of us usually don't recognize is that for symmetry, wherein the shapes, especially as kids, when we used to walk on the school tiles, we used to play like, skipping the white tile and jumping on the black tile. It's usually a play for all of us, but for some people with this obsession for symmetry, it's very difficult, wherein they cannot cross a particular path if they don't, step. If they step on the white tile, they'll have to come back and go. And something like they cannot cross jointed doors or they cannot cross arches. So they have this obsession for symmetry. So if there is an arch, they'll have to go the other way around. They cannot go through an arch. So, and if there is a black stone and a white stone, they cannot afford to cross a white stone. It's something like that. And then for positions, as in keeping it in the second or the third position, there should be no interchangeability of positions. And then sexual obsessions are very common, as in a particular sexual act, or or it can be an imagery of people in an act, or sexual organs, which is very common, and people usually find it very difficult to express this. And blasphemous thoughts, that's very common, as in, you get thoughts like derogatory thoughts against God, you start preaching bad things against God. Sometimes you get sexual thoughts towards your deity. So all these are very incapacitating compulsions. These really make you feel very bad. Then apart from that, it can be sometimes compulsions can be with regard to the quantity, as in the amount of food you take or the time you take, even that. Um, yeah, these are the few things. With colors, they can obsessions can be with regard to colors, where you are fixed that certain colors are not for them. So it can be even with regard to days, numbers, and some activities like doing this 3 times or counting something 5 times, or you do it 6 times and you don't miss the count, or you again repeat it. You repeat it in sets of six, so
Yeah.
something like that. So all
Yeah.
these are coding against
Yeah.
coding things, unable
Yeah.
to let go of your junk. So
Yeah.
all these are
Yeah.
obsessions.
Also, I think repeated checking, right?
Yeah,
Pathological. Yeah,
I forgot.
if the door is locked or not, if the stove is turned off or not. See, my mother checks if the door is locked or not multiple times. Maybe my grandmother checks even more times. Especially when there is a theft in the neighborhood. Maybe they check it. That is not OCD, right? Because they think it is rational. It's for the safety. But in OCD, they know it is logged, but they have to go and check. Otherwise, they'll be anxious. So this is the difference. So people to understand. Yeah, I think we pretty much covered all the obsessions and compulsions. At what age does classically OCD begins?
Usually, actually, we can divide it into classical OCD and something secondary to a medical disorder. So
Yeah.
the simple OCD is a psychiatric illness. Usually, we expect it at the age of late teens and early adulthood, somewhere between 16, 17 to 23, 24. That's the time. Usually, they come up to us. But once they come to us, they usually report that no, doctor, this has been there for quite some time, but I never knew. So the symptoms they themselves would say predated to a few years back. So usually it's this stage when we see the typical OC symptoms, people with
Yeah.
OCD. The other spectrum whom we see is people with traumatic brain injury, having a road traffic accident and some injury to the brain, they might develop OC symptoms. Another group is post-stroke, people who develop hemiplegia or paralysis on one side and slowly recover from it. They might have a residual OC symptoms. Any type of head injury, and epilepsy patients. Over the course, they can develop any psychiatric symptom depending on the area where the oxygen is less. So they can develop OC symptoms also. And the prolonged substance use, especially cannabis, has also known to show that they, in the long run, can cause OC symptoms. So these and all will probably appear in a later age group, but the typical profile would be usually in the earlier age group.
Yeah.
They would
Men
have
more, right? Men more affected or women more affected?
men. Yeah, according to studies, men it's more common in men than in women.
Right.
But
What's
the
the
genetic vulnerability, nothing is proved, but still men are more common than women.
right? Right. So I mean, you also mentioned about risk factors, right? According to that.
Yeah.
Can OCD be hereditary, genetic?
Yeah, as in it could be genetic, but we haven't identified any particular gene, as in like in other genetic diseases like Alzheimer's or Downs, we don't have a particular gene to blame. But in population studies, what they have shown is the probability of me getting OCD is higher when I have one of my parents or one of my siblings affected with OCD and any one of my first degree relatives. So the probability is higher in me than in another person. So that is what the studies are pointing out.
Right. Also, for people who are watching, the prevalence of OCD, the last time I checked, was about 2 to 3%, roughly. But for people who think they have OCD, is about 20 to 30%. Yeah. Also, a few simple questions, right? How like if someone has these symptoms, if they realize that these are the symptoms, what can they do?
Yeah, the first thing is I think they'll have to consult a psychiatrist because some of them can be very incapacitating. That,
Yeah.
like it can prevent them, it can pull them down in their studies or profession or whatever. So once a formal assessment is being done, and once we know that he's suffering from OCD, Then, see, OCD usually comes under the anxiety spectrum. So we usually educate the patient as in he's having such a disorder and this is why he's suffering from all this. And then when we start the treatment, we initially suggest relaxation methods, as in, to every day relax his mind, wherein we have a method called JPMR, which you must be knowing. So we teach them that. Then we teach them to have a healthy lifestyle, as in, the diet, exercise, everything to be taken care of. Because the basic need being, once you're on medications, it's based on your weight. It's always per kg, the dose. So the more you maintain your weight, the dosage is going to be less. So that's the basic funda for any disease. So we're going to talk about that, and then we're going to start them on drugs. Definitely, there is no use of only non-pharmacological. We have to start them on drugs along with other methods, which will go hand in hand. So that,
Yeah.
and then we wait for the improvement we see.
Yeah, because a lot of people think that counseling and medicines are two options. They're not. Medicines is definitely the first line of treatment. I'm not saying it because I am a doctor, but that's the only way you would get treated. Alongside counseling also can be done, but you cannot surpass the medicines and just take counseling. That is very, very important. Also, when you're coming to doctor, please bring all your other medical reports as well, because like Dr. Archana was mentioning about a lot of risk factors. We would like to evaluate for those risk factors. Sometimes you might not know the history. Your bystander might not know the history. Or some of the drugs, medical drugs also can cause OC symptoms. So we would like to rule out if you are on those medicines or not. So always bring your entire, I always tell my patients, when you're going to bank and a doctor, please bring all the documents.
No, actually, it's a good thing. Some of them usually fail to bring the reports and they come again with the report. And like you said, sometimes obsessive symptoms can be the initial presentation of something else. Like we've had patients where we started treating the obsession and later found out he was actually having seizures, which was unrecognized. So with the OC symptoms, it was an output. It was a presentation of the seizures. So once the seizure got controlled, the OC symptoms were also under control. It was a byproduct of this epilepsy, which was not diagnosed. So there are many things which can happen. Sometimes, patients ask us, why are you describing a CT scan or MRI? There's nothing to do with my head. So it is only a psychiatric ill. So the issue is, it is not, the presentation might be a mental illness, but there might be an underlying brain damage, which is actually unrecognized. This can unravel a brain damage also. So that's the reason we usually prescribe an EEG or a MRI or CT when you have some doubts like that.
Yeah, especially if you're coming like in an atypical age of onset with atypical presentation. Definitely, we always think of some underlying physical condition of the brain, for sure. A lot of people think OCD is not curable, right? OCD cannot be managed. It's a lifelong, suffering. What are your comments on that?
See, actually, sometimes we'll have to, when we start treatment, what I usually do is, I don't predict the prognosis the very first sitting, because it will totally throw off the patient. Each patient is different. You have 5 people with OCD, the drug might be the same, but each patient might respond differently. They might have different comorbidities. So I usually observe the patient for a month or so to see how he's progressing, at least for 2 to 3 months. And then we say, see, there are 2, 3 ways of how the illness might progress. One is they might have a single severe episode of OCD, and with treatment, the symptom severity might reduce to quite a manageable level, and probably a very minimal dose of medication might be required throughout after that. Another scenario may be wherein there is only a partial control of symptoms and he requires a substantial amount of dose lifelong. And the third scenario may be, it might be the only episode which he's probably taking treatment for a year and after that he might never get it. So it can be episodic, it can be a plateau wherein there's a minimal symptom throughout his life but it's totally manageable. Or it might be a little severe, type wherein he requires medication lifelong and he needs it to be, stress-free. So you can fall under any of this category.
Yeah. I mean, there's no one way. There are different types of patients, different categories, right? What if my personality is as such that I'm having a lot of symptoms might look like OCD, right? I'm very perfectionistic in my approach. I would want people, I'm a control freak. Like I want people also to work according to my rules and regulations. Or, I'm always washing or arranging things in a particular order. I'm almost like Mr. Perfect, right? Could I be having OCD, or there is another condition?
I usually tell my patients, a patient with OCD is a distress for himself. Patient with OCPD is a distress to others.
Yeah.
It's very difficult to talk with a person with OCPD. See,
Right.
in a person who's having a personality problem, not a problem might be, in most of cases, it's an advantage only. A perfectionist, they're not distressed by it, they're happy by it. They're very happy to say that, I am like this. I want things to be. They're very happy. They wear it as a badge, like you said, Mr. Perfect. So it is like something which they show off. Whereas a person with OC would never show it out. You would be shocked to know that the person even has OC. Especially those who do not have the compulsions, you would never even know what has been in his mind for so long. So whereas with the OCPD, it is quite straight. He's quite vocal about it. He's very open, very happy, very proud about it. So that's the major difference actually. And they make excellent bosses, people with OCPD. No, so it's very tough actually for employees to work under someone with OCPD, but it's very good for the company.
True, true, true. So that is that, guys. I mean, OCPD is obsessive compulsive personality disorder, or it can have personality traits also without a disorder. That is completely different from OCD. OCD is a anxiety disorder. It's a type of anxiety disorder. OCP is a personality, not OCP. Sorry, obsessive compulsive personality traits are type of traits. There are different kinds of personality that we all fall into. OCPD is one of that. One of the points that you just raised is, can someone have just obsessions without compulsions? Can they still be diagnosed as OCD?
Yeah, true. See, the reason it is named OCD disorder is it can either be only obsessions alone, or it can be only compulsions also sometimes without thoughts, or it can be a combination of both. We can have the obsession and then there's an action to reduce the anxiety. It can be both. Usually it's both, that's common, but sometimes, especially these blasphemous thoughts and these imageries, especially sexual obsessions, usually the compulsions are very less for these sexual obsessions. As in, they get the thoughts and they get very distressed about it. They don't have any compulsion to overcome it. So it is a distress, and because of the distress, they might not look into the eye of the opposite sex. They might have a problem looking into them at the eye, or they might have a problem going to temple. So that would be the compulsion. It would not be a day-to-day basis like washing hands or anything like that. So there can be only obsessions without compulsions too.
Yeah. Also, there are a lot of evidence that there is a link between OCD, Tourette syndrome, tic disorder, even depressive disorder and substance use disorder. So people who deny treatment or who just prolong it understand that when one disease is not treated, it's the rule of your health or disease, right? When one disease is not treated, it will lead to multiple other diseases. So you have to be very aware of this, right? I think we will wrap it up with one important question. What
Yeah.
is your experience of the effect of the pandemic on OCD as a disease?
Yeah. So actually, anxiety as such, the entire spectrum of anxiety disorder has increased because of the pandemic. Because people have been continuously being warned about something which is unknown. It is something which is unknown, not familiar. There is no treatment for it. So it brings in an fear, and they very well know that the fear cannot be addressed by even the medical professions. It can only be prevented, but if if you get affected, there's nothing to treat. So that has aroused anxiety even in a normal person. So even people who are falling in a normal spectrum have been shifted to the anxiety spectrum. We see a lot of people getting anxious just secondary to the pandemic. So people who were previously anxious and maintaining well, they have relapsed. As in, they have started taking medications again. And there is a third group who were already on treatment. The symptom severity has increased. But again, there is another group who are quite happy, who have been watching all along, and now they feel that, chalo, now you come and join us. So they are like, this is what I've been doing. It is just like, now you're getting into my world. You know how it is like to wash your hands so many times, because we see so many people with dermatological problems because of this excessive hand washing. They don't fall under OCD, but it's because of their anxiety that they are washing so much that they have the skin peeling and all. And then the dermatologist refers to us whether he has OCD, but then it's just anxiety. So the pandemic has definitely increased the probability of obsessive compulsive disorder, or unmasked a lot of people with OCD.
Yeah. Also, at the same time, everybody who is following precautions, just because you are sanitizing more than other person, don't think that you are the one with OCD in the family. No, yeah. I mean, it's better to be safe than sorry. That is true. But what I tell all the patients who are coming with this so-called excessive sanitation, I tell them, like, don't set your own rules. Follow the rules or precautions given by your CDC. That's your Center for Disease Control. When they say only 10 things to do, only 10 things. If they ask you to just wash for 20 seconds, 20 seconds is enough. You don't have to do it like 1 minute for extra precaution or protection. That's not going to happen, right? Yeah. So because all these precautions are coming from a lot of research, nobody's just sitting and saying these things. So you can put your blind trust and follow that. So don't set your own rules. Please follow CDC, and also don't follow your WhatsApp messages of doing this or drinking that will reduce COVID. No, you have to be careful.
Yeah, the pandemic is not yet over, so all those with your masks down, please put it on. We may well have a second wave if everyone removes the mask. So I think, and actually something else which I forgot to mention is the neuromodulation which is coming up for OCD.
Yeah.
It's coming up in a good way, and we are seeing changes, especially OCD with depression and secondary to some organic diseases. RTMS, TDCS has shown some degree of change with the medications, of course. So anything can be clubbed with medication. So that's the first line, like you said. With medications, combining neuromodulation is also is proving to be very beneficial, especially to severe resistant OCD and patients with severe symptoms. So that's another newer mode of treatment which is coming up. So I
Right.
think people should be informed about that also.
Right. Also, everyone who wants to know about neuromodulation, Dr. Archana is a certified neuromodulator. So if you are in Chennai, I think you can reach out to her. She should be able to help you for sure. Right. I think that's our time. Thank you so much. It was fun. I think we are catching up after a long time by talking about
Yeah,
condition. I will save this live. If any of your patients want to see or you want to send the link, you can please feel free to do that. I'll share the link with you as well. Right. Thank you so much. I'm glad the cyclone didn't really hit our live,
yeah, seriously, because I was just wondering that whether it might affect the Wi-Fi, but it's fine. It was fine.
Yeah. Yeah. Thank you so much. Thank you. Thank you for taking out time. Take care of
Thank
yourself.
you so much. Thank you. Take care. Bye and keep in touch.
Yeah, sure. Bye.
Bye. Thank you, everyone.
So that is Dr. Archana for us. I hope we kept the talk small, short, just because I want you all to pay attention, because we all have only focused attention for about 25 minutes. So I'm realizing doing a lengthy 1 hour talk is not going to go through any of our heads. So if you have any more doubts about OCD, you can ask now. Also, one more thing we forgot to discuss is that during pregnancy and during menstruation every month also, there can be exacerbation of OCD symptoms. Not in every woman, somebody who has diagnosed with OCD. So keep a watch on that. For example, if you are an OCD patient and treated and you're off medications, now you're going to have a child. You don't have to be worried. It doesn't happen to everybody. I'm not scaring you, but always have an insight that probably it can get exacerbated. If it does, please see a doctor immediately. Probably the same doctor that you are treating, that you are being treated. Also, I think I would like to end the live by saying that OCD is, in a nutshell, it's an anxiety disorder. It has two things. One is obsession, one is compulsion. Obsession can be a thought, an image. You can have recurrent image also, not just thought, or an impulse, which cannot be controlled. If you try to control it, you have a lot of anxiety. Just to reduce the anxiety, you will do an act. That is called compulsion. Compulsion is an act, obsession is a thought or image or an impulse. This much you need to know. And it's not just washing hands, there are many, many other things. Please get evaluated. Also, don't think it is fancy to call yourself OCD or I have OCD. Even a lot of film stars and, even in the TV, I was watching, a lot of people are saying, while keeping the things clean, that I have OCD or she has OCD. Don't do that. Please come and see a doctor if you have OCD. Don't turn it into a very fancy terminology that you have, because only people who have the disease, they understand what kind of burden it does to their quality of life and people around also, as a family, how people suffer. So it kind of is infuriating if you invalidate someone's disease by turning it into an English word. So don't do that. Um, hope all of you are staying safe. I know we are probably predicting a second wave. So all of you be careful. When I'm going out, I'm getting freaked out seeing people are wearing masks here, not here, not here, not here, here, and clip it or pin it here. You have to be very, very, very careful. Don't think that, pandemic is over. I hope all of you are staying safe and taking care of yourself and people around you. Tune in next Wednesday for another topic.